pandemic weeks ago. The WHO takes an unusual approach to how they characterize these kinds of infections. But in terms of a classical definition of what constitutes a pandemic, epidemic spread on multiple continents, this really met that definition a while ago. I heard your comments earlier about the estimates that this could infect tens of millions of Americans. I think that really is a consideration in the context of if we don't do anything. I think if we take tough mitigation steps right now to try to stem spread here in the United States by engaging in social distancing, canceling the events you're talking about, asking businesses to have workers telework, closing down places where people congregate indoors in areas of outbreak, if we take those measures right now, we could be on a much different trajectory and look more like South Korea than look like Iran, where Iran seems somewhat helpless and is allowing the infection to course through their population largely unchecked. So we really have a window of opportunity. It's a narrow window of opportunity, but a window of opportunity to keep the figures down in terms of how many people are going to become infected in the U.S. this go-around. And then the infection may come back in the future. It may come back in the fall. It may come back in the winter. But by then, to your point, we may have a therapeutic and eventually a vaccine.
What I don't understand is people like you, very well respected, your voice is listened to, you are inside the administration, and you are saying what you are right now. Tom Bossert, the former head of Homeland Security within this administration, was ringing the alarm bells yesterday. I hear the same thing every day, day after day after day. If we do this, if we do that, things can be better. We can stop this. Are we doing enough as we have this conversation today?
No, we're not. We're not taking the kinds of tough measures that we need to be doing in places where we know that there's community spread and sustained community transmission and large outbreaks. Seattle isn't doing enough. There are other cities now, Santa Clara, Northern California. You know, if you look at what New York is doing, Andrew Cuomo has taken tougher measures in New Rochelle, closing down local social halls and other places where people congregate indoors, canceling events. We need to be doing that on a wider scale, especially in areas where there's outbreaks. The one encouraging thing is that businesses are stepping up to take action, to start engaging in social distancing by asking workers to telework, by canceling conferences. But it can't just be the business community driving this. The governments also need to follow suit, and I think it's been difficult for some local governments to take these measures because they recognize the impact it's going to have on their local economies. And that's where Congress needs to step in and fashion a package of fiscal support that isn't aimed at stimulating the economy, but is aimed at supporting states and localities that take the tough measures to break chains of spread, knowing that it's going to impact their local economies, and supporting the individuals who are going to be hurt by those measures, people who are going to be out of work, people who can't telework, people who can't afford child care. Or can't afford, meals for their children because the children get meals at school on assistance programs. We need to support those individuals so that they, too, can engage in the activities that's going to break the chain of transmission here.
Do you think the administration has been truthful with the American people up to this moment about what the risk really is?
Look, I think that this has been an evolving story and an evolving message. I think, early on, maybe some folks didn't fully appreciate what the true risk was of epidemic spread here in the United States and how long we could contain this for with some of the travel restrictions. But I think where we are right now, I think people understand the gravity of the moment that we're in and the fact that we do still have this window of opportunity to try to mitigate something far worse in the United States, a larger epidemic. We need to do that now. The risk is that if we don't adopt these measures, we'll have rapid spread here in the United States, and we'll have a surge in cases that's going to overwhelm the healthcare system. And that's when the fatality rate starts to rise. That's what we saw in Wuhan, China. When their healthcare system became exhausted, that's when you saw the case fatality rate start to really spike up. We need to keep the number of infections that we sustain here in this country below the point at which the healthcare system gets exhausted so that we can properly care for these patients.
Are we prepared to do what you suggest or not?
I think we're certainly prepared to do it. I think it takes some political will and some organization. I think you need to do two things. At the federal level, you need to jawbone some of these municipalities to take tougher actions early. and you also need to step in with assistance when they do the right thing. So I think you need to be doing both of those things. I don't think that that's necessarily happening right now. I think it's starting to happen. Congress needs to step in and provide support for states and cities that take tough mitigation steps that's really going to tank their local economies. And I think we need a common systematic approach for when you close schools, when you require businesses to telework, when you shut down gatherings in a city. Seattle, in my view, is past that point. They should have started to take these measures a week ago. It's always the case that when you adopt these strong measures, people are going to say, you're overreacting. Why are you doing this now? We only have 30 cases. You always have to act at a moment that's going to look like it's too soon relative to the crisis, because the epidemic is always further ahead than what you perceive at the moment.
Dr. Gottlieb, how long is that window open in the United States to act?
It's hard to say, Meg. I mean, I think that it's probably the case that we have high thousands of cases here, maybe low tens of thousands at this point, dispersed across the country. Seattle, Santa Clara, those are the pockets of outbreak that we know about. It's possible there are other larger outbreaks in cities that we're not aware of yet. This becomes self-evident when it gets inside institutions where you have a lot of vulnerable patients or people, where you start to see really adverse outcomes and people start to die. So when it gets in a nursing home or a hospital, in Wuhan, it was when it got in the hospital that they really began to first recognize it. In Seattle, it was when it got inside a nursing home. So it's possible that it's spreading in other cities and it hasn't gotten inside an institution where you've seen a localized cluster of severe enough outcomes that it becomes self-evident.
Dr. Gottlieb, we have 30 seconds left before we're turning it over to the next program, but let me ask you this. The NCAA basketball tournament is going to have thousands of fans in arenas all around the country. Should the NCAA hold their tournament with fans? Should sports leagues from this day forward not have any fans at any of their sporting events? Is that the kind of thing you're talking about?
Those are the kinds of things we need to be doing right now. If we want to avert a broader epidemic here in the U.S., we have a window of opportunity to try to break the chain of transmission. It's going to require us to take those kinds of tough measures.
Dr. Gottlieb, we're grateful for the time. Thanks for coming to the phone. We'll talk to you again soon.
Thanks a lot.
That's Dr. Scott Gottlieb, is a CNBC contributor, the former FDA commissioner as well. Meg, thanks so much.
Thank you.
Let's just check the